In the dialysis unit, you might have seen patients who are having recurrent hypoglycemia, low sugar during dialysis. Today we are going to discuss regarding this particular topic. Hypoglycemia. It can be because of two factors, which is patient related and the dialysis prescription related. Patient related because of sepsis or whatever the causes a patient can have, that is a separate entity. We are going to discuss only the dialysate prescription or dialysis prescription related. You can see this is the dialyzer, blood is coming, dialysate is on the opposite side. The dialysate ideally contains glucose in the form of dextrose. How much it contains? 100 to 200 milligram per deciliter is the average value in this fluid. It should be. So what are the advantage of having dextrose in the dialysate? One, the patient nutrition will be maintained. Second, hypoglycemia won't occur. Third, the catabolism is low because the patient on dialysis they are more prone for catabolism. The catabolism chance will less. This is what they are shown in the trials. And there are dialysate fluids, cans, which contain zero dextrose. That is called dextrose-free dialysate. Two kind of these can comes. The two cans which are there. One is bicarbonate can. Another one is the part A or the electrolyte can. In the part A or the electrolyte can contains the dextrose. As I told, other set of can which doesn't contain dextrose is the glucose-free part A. When to use that? In a diabetic patient, if you feel there is a risk of hyperglycemia, then you can use potassium-free can. So it is a special entity where you have to use potassium-free can in a hyperglycemic patient, not in all. And we have seen patients who are in primary care or secondary care dialysis center. They come to the OPD and say, "Sir, every time my glucose goes down, despite I didn't take my hypoglycemic medication." It occurs because of they are using glucose-free can. That is why ideally this dialysate from where the part A, from where this dialysate forms, bicarbonate comes from B, water get mixed and finally this is formed. It should ideally contain 100 to 200 milligram of dextrose. The value varies with the each manufacturer. Otherwise, the patients are prone for hypoglycemia. Is there any disadvantage of having dextrose in the dialysate? One disadvantage is if the patient is already hyperglycemic, it will raise the sugar. And they have proved it increases inflammation somewhat. It is all theoretical only. For clinical practice, if the patient already hyperglycemic, preferably don't use. In rest of the condition, always use a can or part A which contains dextrose, glucose in the form of dextrose. That's all regarding the dialysate composition today. Tomorrow we will see regarding magnesium, dialysate magnesium.